Just straight out. All right. It is May 23rd. Don't move.
Keep your arms still, please, okay? You need to keep your arms still.
2023, and we're here at Deuk Spine. Our patient comes from Pittsburgh. She has thoracic pain, and I asked her to show me exactly where it is, and she put the X's, and then we got an X-ray, MRI, and guess what? That's exactly where her herniated discs are. So she's very in tune with her body, and we're going to go ahead and get started to fix 3 discs in her back. T6-T7, T8-T9, and T9-T10. All right, let's go ahead and bring the flora back in. Feel free to watch as you watch the most state-of-the-art spine surgery in the world. And we're going to fix a problem that no other doctor in the world is able to fix. Okay. Let's go. I need a needle. And some num-num. First, I'm going to numb the skin. The patient is here with my anesthesiologist. She's laying prone on her belly. Luis has gotten her position nicely. Her face is good.
Yeah.
Her eyes are no pressure. All right. So when you're doing thoracic spine surgery, it's important that you avoid injuring anything in the thoracic area that could be injured. There's many things that could be injured, including the spinal cord, the nerves, the ribs, the blood vessels, muscles, fascia, all kinds of things, lungs. So we're going to get started. How long has she had pain for?
5 years.
5 years. Okay, let's go with the lateral. Wait, just give me a 12. Let me show me 12. Come south. Shot. Keep going. Just a little bit more. Shot. All right, there's 12. Show us the pedicle at 12. This is how we count, folks. 12, 11, 10, 9, 8, 7, and then 6. So that is the 6-7 disc. Show us the 6-7 disc. Everyone agree we're approaching 6-7 from the left?
Yes, sir.
All right, let's go back. Let's go to a lateral view. So we're going to use a combination of AP and lateral views to get to that disc to fix it. All right, we need to go up north a little bit. Thoracic spine is difficult because I need to go a little bit more north if we can. I know the arm board may get in the way. Can you check her arms, Dr. Berndes? This is where we need your help. Okay. I'm right on the rib. Shot. All right, I think that's 6-7 there. So I need to be up just a tiny bit. Shot. And shot. Looking good. Give me an AP. Nice. Give me, let me see T1. I need to see the first rib. Just be prepared to slide north. Shot. A little more. Shot. All right, so there is 1, 2, 3, 4, 5, 6, 7. Everyone agree? 6, 7. Now let's go to the bottom and show us 12. We're going to double verify the level. Thoracic is tough because you can only verify with ribs. It looks like 12, 11, 10, 9, 8, 7, 6, 6, 7. So on both bottom to top, top to bottom, we verified 6, 7, and we're coming from the left side. So far, so good. All right, show me the lateral view, please. That AP is a little catawampus. You can see the spinous process not in the middle. So we need to clean that up next time we come back. All right. For those of you watching, we are in the first phase of the surgery, which is to access the disc through a transforaminal approach. Don't move, shot. All right, we're at the facet. Shot.
A little discomfort here. We're just finding, finding GPS on the roadmap here for your disc. Slow, deep breath here, doing
You're doing great. Shot.
nice, deep breath.
Uh-huh. So I got to get around the facet joint, which is what I'm doing. Shot. You mean AP? Just take a deep breath. You're doing great. She's awake, by the way, but she's sedated. So we can't have her completely asleep. And you see you're off on orbit there, by the way? On that lateral, you're off on orbit. But go ahead and, that's beautiful. Look at that. Perfect. Perfect positioning. All right, let's go back to a lateral view. So far, so good for this young lady. She is a housewife, as she told me. I asked her what she did. She said, I'm a housewife. And she's just been miserable for years, suffering with this pain. Nobody's been able to help her with. All right, I need to zoom in. I need you to fix the orbital issue. We need to do an orbital fix. I think you're off by 2 degrees to 3 degrees on orbit. Shot. Still off on orbit, but it looks a little better, but we're overexposed too. What do you think, Jordan? Yeah, I think that's too far. Try back a little. That's better. That's better. Yeah, that's better. But it's still not perfect, but that's good. All right. You're doing great. Shot. So we're heading right for the disc. Any way you can give me a better view in that disc? I think you're off on the disc. You're off. You need to change your WAG. Can we get rid of that blue stuff that's in the way, please? It's really a bit distracting. That's better. All right, I think, Jordan, there's something going on the orbital. Don't you think? I need you to WAG it in. I think you're off on WAG worse. Let's check that. That's better. Definitely better on the WAG. On the orbit, it's not horrible, but you can see the facets are off. So try something. Shot. What do you think, Luis? Better? That looks better, right? Actually, that looks better to me. I think we should go with that. Shot. That's inside the disc. We're in the disc. Nice job, everyone. That's beautiful. So we're inside the disc. Now hold on. Let's hold on. I want to get a nice confirmation view, AP. I want to verify on bottom to top, top to bottom one more time, because once we know that this is 6, 7, then we'll skip a disc. We'll skip 7, 8. We'll do 8, 9, and 9, 10. So we'll skip one disc down, and then we got the next two, and we could use this needle as our reference point. So far, so good. All right, so that's too far north. Come down a little bit. Shot. That's a little better. So there's 1, 2, 3, 4, 5, 6, 7. I got 6, 7. Let's count from bottom up. Are you getting all this, Henry?
Yes, I am.
Thanks. All right, there's 12, 11, 10, 9, 8, 7, 6. So we're 6, 7 both ways. All right, let's work on the next ones. So I need you to get me a better AP because you're not directly centered. You can see the spinous process not between the pedicles. She probably has a little bit of scoliosis. Shot. Berndez, everything good on the lung fields? Good. A little bit more.
Steps are 100.
Perfect. Lung fields look okay to me. All right, that's probably okay. All right, so we know that we're at that disc. And then we're going to skip one, right? And then we're going to do one on the right, and then we're going to do one on the left. Everybody agree? So I need to go down 2 discs on the left side. Everyone agree? All right. And shot. So 1, 2, I need to go to the lower one. Shot. All right, I think I'm a little too high. I need to start a little bit lower. Shot. All right, let's go lateral. 1, 2, I need to aim lower. And then we'll come back to AP in a few minutes. So we are, as you can see, literally her pain is exactly where these herniations are in the MRI. And the funny thing is that the 1, 2, 3, yeah, I need to be a little bit lower. The not so funny thing, folks, is that all of her doctors at home miss this. And most doctors do, miss it. They miss it because they don't know what to do, even if they found it. Unfortunately, Sean, the doctors just don't know how to treat this. They just don't. Lay still, you're doing great. That's got to be your facet. I'm touching. Need to be a little bit more lateral. Num num. You got to find exactly the right spot. Give her a little more numbing medicine. Thank you, Luis. Great job. And shot. Yeah, the wag is worse. Let's get the wag right first. That's not too bad. I like that. That's decent. I may be a little bit too high still. I have to see. Shot. Let's get an AP. Thanks, Luis. I think I'm too medial. Hitting the facet. Just a quick AP. It's a quick AP. Go. Yeah, I'm too medial. Go back to lateral. I'm just a millimeter too medial. I could be a little bit more lateral, and I think we'd be fine. And I don't mean my entry point. I mean my trajectory. There it is. So it's perfect. Shot. Yep, perfect. So you see how everything like a millimeter makes a difference in spine surgery. Shot. Just about there. Doing all right? Believe it or not, shot. That facet is magic. Magic, just pure magic. Shot. We're there. Beautiful. Oh my God. So perfect. I love it. So far so good. And I believe her husband is probably watching from the waiting room. Look at this coverage, folks. She knew exactly where her pain was. All the MRIs that she had done at home said normal, normal, normal. But when I looked at it, I found the herniations. There were 3 of them. And they're exactly where we're operating. Everything's going good. You all right? Hang in there. We're almost done. Let's get some more num-num. Huh? Any questions? You're watching history, folks.
Future of spine surgery.
No one in the world has ever done this before. I mean, literally 3-level thoracic, endoscopic, transforaminal. Nobody. You're watching history, but these people can't live with the pain. They want it fixed, and I don't blame them. All right, let's get these cables out of the way. Shot. All right, I think I'm a little too low. I need to start a little bit higher.
No current questions, but we do have a comment from Brian on YouTube that said, I had a T8 through 9 discectomy through the metrics access. It didn't work initially, but over time, thankfully, it did.
Wonderful. Wonderful to hear. Wonderful to hear. You're doing well. Shot? It's pretty cool that you're here watching this. Shot, I'm right on the facet. Lineup looks good. Stay still, you're doing great. Don't move, we're almost done. There it is, we're right around the facet. A little bit higher than I want to be. That's real. It looks real. Yeah. Hang in there, you're almost done.
Last one.
Shot. Shot. That looks pretty good. Shot. Oh, that's better. Shot. You're doing great. We're almost done. Come on now. Just a little bit more. We got this. Shot. Just about there. I'm literally slipping around the facet. You're doing great. There it is. Holy mackerel, I can't believe it. We did it. Incredible. Hey, you're doing great. We're almost ready to put you to sleep. Okay, we've lost literally 4 drops of blood. Okay, let's get an AP, verify all the levels, and I want her fully awake. Oh yeah. Very nice. All right, so let's go down to T12. We're going to count up. There's 12, 11, 10, 9. Everyone agree 9, 10 is 1 on the left? And then 8, 9, skip, 7, 8, then we got 6, 7. All right. Let's go back to a lateral. The lung fields look good. Any questions? So for those of you wondering, what are we doing here? We're fixing disc pain. She has painful discs. They're very subtle. They're not big herniations. They're tiny. And what's causing her pain is inflammation in those discs. Are you comfy? Can you hear her?
How are you doing? You okay?
Any pain?
pain? How are you doing?
She reliable?
No, still sleeping.
Okay. All right, well, while we're waiting for her to wake up, I just want to show you guys one more thing. So we have 3 discs that are, I believe, are causing her pain. That's number T6-T7. We skip one, and then you got T8-T9, right? And then
T9-10.
T9-T10. Yep. So this one on the MRI, it looks fine, but then her pain also skipped. So she was like literally, have you ever seen that? Like people say, oh, back pain is non-specific. Bullshit. The patients know exactly where it hurts. It's highly localized. This is the key word for today, folks, localized. And this is what you have to understand. For pain to be localized in your body, it means it goes to one place and one place alone, the primary somatosensory cortex. It's called the primary somatosensory cortex. It is the in the parietal lobe, and it is the post-central gyrus. It's called. Lay still. And it's special because when fibers transmit signals to the primary somatosensory cortex, it means that you can localize exactly where the pain is. It goes against all the teaching about back pain that it's non-specific. It's baloney. It's specific. And this patient is living proof of it.
That's why there's dermatomes. That's why there's physical exam. You examine patients better than any surgeon I've ever seen.
Yeah, but the dermatomes are skin, and we're not treating the skin, we're treating something deep to it. And everyone's saying, oh, it's non-specific. Bullshit, it's specific. Are you ready?
How are you doing? You okay?
You okay?
She said yes.
All right. Are you having any pain?
Are you having any pain right now? My friend, are you having any pain right now? No?
Are you having any pain?
No.
She okay?
Yes, she's okay.
Well, here we go. How bad is that on a scale of 1 to 10?
1 to 10.
Shot.
10.
10. Is that where you get your pain? Beautiful. Is that where you get your pain?
Yes.
10 over 10, folks. Concordant. Beautiful. That means we're going to get rid of that pain today. She's not going home with that pain. I say one thing. Praise God. All right. No, we're not ready for that yet. We have 2 more. All right. Are you better?
You feel better?
No more pain?
No more pain?
Who? I just basically broke the syringe. I cannot inject.
Can I have 5 cc?
Hold on now. Let me think. Let's try this one. These discs. How bad is that? 10? She said a 10, I think.
Yes.
Is that where you get your pain? 10 over 10, T8-9. 10 over 10, concordant T8-9. That leaves 1 more to go. I'm sorry? I can't hear you. Ah, that's a great idea. My God. Hey, guide wire. You're a smart man, Dr. Berndes. I knew we kept you around for something. Shot. We're going to pipe clean this thing. There it is. Shot. Yeah, baby. I love it when a plan comes together. And here we go. She comfy? Yeah? Oh, but it's just, she's got so much scar tissue in this disc from chronic inflammation. I can't get anything out. She having any complaint?
Any pain right now? No.
All right, I couldn't do the discogram at T9-10, but she had 10 out of 10 at 6-7 and 8-9. I just couldn't test T9-10. All right, we're going to put you to sleep. When you wake up, your surgery will be done. Count from 1 to 100 for me out loud. Nice and loud. Keep going. Incision. I'm going to make a 4 mm incision. The whole surgery, this is an outpatient surgery, by the way. It's done with a 4 mm incision. That's why it's virtually bloodless. Shot. Holding the guide wire and taking this needle out. Shot. Beautiful. All right, now we have a safe path to the disc, just past the spinal cord and lungs and everything else. We're going to bring our dilator down. You guys see the dilator, Henry? It's like a skinny little metal tapered pencil.
Yes, we do.
Believe it or not, this patient will have no painkillers after surgery. Shot. No narcotics. We don't give narcotics. Opioids, the dangerous meds. Don't need them. Not after the DLDR. You're doing great. Hang in there. How's she doing? You're doing great. Just take a few deep breaths. We're going to put you to sleep. You're doing awesome. Shot. Okay. Everything going well so far for this young lady. Poor thing has suffered for years, undiagnosed. Told she has fibromyalgia. Told that there's nothing that could be done to fix her. And she didn't believe it. She had faith. She searched the internet. She found Deuk Spine. And she traveled here with her husband. And here she is now getting her surgery that I believe is going to cure her pain. All right, not quite there yet, but we're getting there. Let me think. Got to twist this dilator down. Okay, we're almost there. How about the impactor? Do we have an impactor? Let me have it. Just about there. I want a little help from my impactor. My impactor is what I smack with the hammer. Everything okay, doctor? Well, I'm going to drive this down a little bit, gently, into the disc. There we go. Hey, she all right? Shot? Yeah. We're making it. Take that. I'm going to pull the guide wire back just a smidgen. You can see the front of those discs, by the way, folks. Actually, that's a great picture. Don't take another one. Henry, look at this x-ray. Look at the x-ray. Now, can you see it, Henry?
Yep.
Jordan, show us the front of these discs. This is what gave away which discs were bad. Look at the spondylosis, the injury to the disc. Okay, there, and show the other two down below. Uh-huh. Yep, that's right. So when I saw that, I said, that's got to be our source of pain, our pain source, because it lined up perfectly with her pain. All right, we're in. Beautiful. Everything's going well. She's asleep, and we're making great progress. Now we're going to do the Deuk laser disc repair thoracic. Uh-huh. Shot. Beautiful. Uh-huh. Shot. I don't want the dilator to go any further, but I want to bring my tube down so I can do the surgery. Shot. Beautiful. We're in. Take. Help me. Oh, I think I got it. There we go. Awesome. Any questions? Let's get the fluoro out.
No current questions.
So you can see with the tube, we're actually inside the disc. Get an AP. Let's capture the AP, Henry. Shot. Nice. Look at that. Perfect. Give me a real AP, though. Come on, Jordan. Get that spinous process lined up. Shot. That's better. Okay, you can see we're inside the disc. And that's how we're going to do the whole surgery, endoscopically. let's show people how does a disc injury cause pain. Let's run the lumbar. What causes back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. We are inside the T6-7 disc. And folks, this patient is getting the one surgery, the only surgery that can actually help her with this pain. She has disc pain. This is in her thoracic area, and that disc pain has been plaguing her for years. It's slipping. Light on.
Light on, please.
Let me have the dilator. Mallet. Mallet. Mallet.
Jordan, can you walking sleeves? Cervical, please.
Yeah, it looks good. What do you think it is? Huh?
Try now and stop and walking sleeves. Stand by here. Thank you.
Again, she had MRI done in Pittsburgh, and they read it as normal when it really wasn't normal. And they basically took her hope away of getting fixed. Yeah, it's definitely struggling to capture. I need to pull it back a little bit.
Jordan, can you take care of the machine, please? Thank you.
This is all damaged disc right here. And you can tell from the way it appears, this has been going on for a while. This is not something that just happened. This has been going on for years. This is an old injury. Luis,
Yes, sir.
how did your meeting go?
So
With
they're supposed to make a proposal, send me an email. I want to send them a video.
Any way to grab this and twist it up?
Yeah. So let's try a different stop that I over here.
It's fine.
Can you lights on, please? Thank you.
Go ahead, put it on. Just put it on. Don't worry about the tube. Sliding?
Yeah, it's sliding.
Okay. Give me something to grab it and pull it up.
Lights off, please. Thank you.
Give me something to grab it and pull it up. Gonna have to try to twist it out a little bit. There, That's twisting it a little better. Help me twist it. Come on, get on there and help me twist. And pull up just a little bit.
Let me know.
Up. Up.
Good?
It hasn't moved. All right, looking good. Now, give me the channel lock or whatever that thing is.
What are you doing?
Give me that thing. The grabber, the vice grip. The vice grip.
Oh, only at my foot.
Let me see. Oh, I need the vice grip, the small one.
Yeah. Fly straight, please.
That's all part of the herniation there. What is wrong with them? Why does it take them so long to get things? I mean, we don't have a Walmart Supercenter. Luis?
I know, sir.
Well, why would it take them so long?
I'm not sure where they put us, sir. So sorry, sir.
You don't know where they put it? You're supposed to know. You got to know everything.
Yeah, I want it. Yeah, that's what. Yeah, that's all.
Where is it?
Lights on, please. Thank you.
Give it to me. No.
It's working or not?
It's not great. Not really working. But I am moving up a little bit, so that's good. But I need to move it up and out. Let's go ahead and change it out with another, nope. Let me have the dilator. Wait, it's working here. It's just not working on the other side. Now this won't even go down. Let me see that dilator and the mallet. Fucking crap. Go. That might work.
It's working?
Yeah. It's just requiring a full spin, which is better than nothing. So, how's our irrigation, guys?
Lights on, please. Thank you.
See that? How it requires a full spin?
Yeah.
Interesting. It's just catching on some of those tines, but not others. So far, everything's going well for her. We're just encountering some technical issues with the tube, which is stuck at the interface with the fluid adapter. But otherwise, her surgery is going just fine. The blue stuff represents degenerated disc. You can see how the laser breaks it up into little pieces. Just disengaged completely. All right, Louis, so I'm going to be gone for a couple of weeks. You know what you need to do, right?
Yeah.
Got to make it a priority, Louis. Okay? Don't come up with reasons to not have a solution. Find a solution. Any questions?
No current questions.
And we're just twisting the tube to get it to draw back. Hold this here. Stop, let go of that other thing. You don't need to hold that. Bring it down more. That's good. Too much. Come on, Luis. Hover it. It's too close. I gotta see. It's too close. Pull it back. There. That's perfect.
Lights on, please. Thank you.
Let go. Let go. How's our irrigation?
Lights off, please. Thank you.
How's she doing? This tube is compromised. Henry, you obviously played the video, right?
Yes, sir.
Lights on, please. Thank you.
of the Deuk laser disc repair
Yes, sir.
and how it works,
Yes, sir.
or did you just do the what causes pain?
I think I did both.
Okay.
Thank you.
That piece of fucking shit out of my face. Luis, you have got to prioritize this, okay? I've asked you to find me a solution for months now. And this is what happens when you don't do that. All right, bring the fluoro in. Let's go, Jordan, lateral, move it. You don't need to move in one plane at a time. Shot. Skin knife. Did you test the tube with your adapter? Shot. 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 Impactor, mallet. Shot. Nice. Take. Shot. Good. This is not compromised? Did you test it?
I tested.
Huh?
I tested. I tested the other one too.
Before we used it?
Of course.
Yeah.
But
Yeah, but it became compromised after. After the impactor. Shot. Shot. Out.
thank you.
Did you talk to Matthew Solar, my engineer?
I talked to him long time ago.
And what did he say?
He's gonna work on that.
No, you got to follow up, Luis. Okay?
Well, I need his cell phone.
Huh?
I need his information. I don't have his.
All right, but don't give me excuses, then ask me. But don't wait till we have a catastrophe and then say, oh, now, yeah, I need a cell phone. You're supposed to be working independently on this. And fixing it, making it right. You understand? Without me having to sit there and meet with you every single day. Hey, did you do anything? Hey, did you do anything? Hey, did you do it? You know, you're beyond that. I should give you a responsibility and know that it's being done. This is too important not to. Okay? He looked into doing scopes. We don't need scope right now. We need just this tube. Yeah, he's got, huh?
He said he's gonna work on the.
I know, but you got to follow up with him. Just tell him all we want is this tube, nothing else. Exactly the same way. Nothing else. Okay? You got it? That's the most important thing. That and the fluid adapter. But I don't think the fluid adapter is the problem, do you?
Yeah, we need it.
Right?
We need it.
What?
We need
No,
it.
the fluid adapter is not the problem.
No, it's not the
The
problem.
fluid adapter is not deforming. It's the top of that tube that's deforming.
Correct.
So,
Correct.
of course. So the fluid adapters we don't need. We need the tubes. See how much easier it is when it's all working properly?
Yeah.
Well, it's going to be a catastrophe if we don't get it fixed, all right?
Every?
So please don't let it become a catastrophe.
It's not gonna happen.
You need a machine shop. That's what's needed. And they can manufacture those tubes.
A metallurgist.
Or get online. I mean, do it all. Get online, look. Where can look for the tubes?
Is he a metallurgist?
Huh?
Is this gentleman a metal?
No, he's an engineer. But he knows companies that manufacture this stuff. That's what their business is. You know? He has all the connections to the companies that make things. And if you can get the design from Wolf, then you just send that over, the CNC, the, what do you call it? Forgot the name of it. Yeah, the schematic design basically is what it is. If you can get that somehow from Wolf, then you can send it over to him and he can get it made. Otherwise, they're going to have to measure it and they're going to have to prototype it, put it into a computer program. Yeah, they're going to have to do a CAD design. CAD design, that's what it is. If you can get that from Wolf, it'll make it a lot easier, Louise. Okay? I don't know if you can, but
You think
Wolf's-
I never tried it for that?
but you got to keep trying. You got to keep trying.
Maybe he doesn't have any sense of urgency, that engineer.
No, he doesn't, but we have a sense of urgency. Our patients have a sense of right? And it's not my engineer only. Luis has taken meetings with other engineers. We need to have somebody come up with a solution that's going to work for us. You know? You don't, not every time you try you're going to succeed. But you have to keep going until you do. And this is one of those things we cannot fail with. All right, that's it. This one's done.
Lights on, please. Stop up. Thank you. You wanna put some?
Yeah. The other one I wanted to as well, but I couldn't. You have two needles, right? Use the other needle. Dilator. That should be all I need there. All right, 2 down, 1 more to go. I'm going to switch sides with Luis. There's no bleeding, by the way. We've lost like 4 drops of blood the whole surgery. No bleeding. No scarring. It's basically atraumatic surgery. Go ahead. All right, Henry, any questions?
No current questions.
Yeah.
We have a viewership.
Good. They're all just mesmerized. So you guys see that? 4mm incision. That's it. Tiny. Shot? All right, so there we go. You can see the guide wire. You see the needle. I'm taking the needle out, leaving the guide wire. We've made an incision, needle here. Now I'm going to bring the dilator down, the guide wire. It's going to spread the tissues. This dilator is like 2.8 millimeters. So honestly, people ask me, are you worried about things? Yes, I worry about things, of course, but once you get the needles in place, the rest of the surgery, honestly, is not that bad. It's pretty straightforward. Except if you have issues with your equipment. shot. You want to watch the tip of your guide wire. Make sure that it doesn't go into the thoracic cavity. It would be bad. All right, so I'm in the disc at this point. I can take the guide wire out because I'm in the disc, so I'm safe. And I can advance to where I want it, which is usually about halfway to 2/3 to the front. Then we're going to bring this tube down, the tubular retractor. Shot. Nice. All right, now I'm going to advance the tubular retractor using the impactor. And this is where you can easily damage the tube right here, which I don't want to do because these things are hard to come by. Shot. It's not even the cost that's the problem. They're just not available. All right, we're done. We're going to do one more disc and we're done. Yeah, you can get out. Thank you, Jordan. All right, good job, Luis. Last one. This is our third disc we're repairing, and we'll be done after this. So if you have questions, feel free to ask them. But so far, everything is going well for this young lady. Poor woman has suffered for years with no help from any doctor, and there's literally no one else in the world that does this surgery. This is the only way to fix her problem. So Deuk Spine pioneered this. I pioneered this surgery with the thoracic. Presented our data about a year ago, a little bit over a year ago in Los Angeles at the Society for Brain Mapping and Therapeutics. I was an invited speaker and presented the cervical and thoracic Deuk laser disc repair. It was very well received by neurosurgeons, spine surgeons, orthopedic surgeons. And my son Arius actually did all the research on this technique, and basically we showed that the patients that had the thoracic DLDR, like you're watching right now, we were able to get rid of 99% of their thoracic pain that they had. At 1 year follow-up, it was 99% gone. There is no other surgery in the world, folks, that gives you those kind of results. We had 0 complications, and as far as blood loss, there's virtually no blood loss. You can see it. Every single one of these surgeries is the same. It's a few drops of blood and that's it. Again, we're seeing the blue is the degenerated disc. It's an indication of a problem. You should see 0 blue disc in every disc. That normal discs have no blue. There will be no blue staining. But only when you have
Same shit.
stuck again. Light on.
Light on, please.
Luis. No, I need to. How many other tubes do you have?
This one,
Mallet?
5.
Better get another one.
Yep. Can I have another tube?
Fucking tines. Pain in the ass. Stuck. I mean, is she light? Is she tightening down, clamping down? Let me have the dilator again. Get another tube.
Yes, sir. Let me have another one, please.
This should fit down there. Fucking. There we go. Now it's working.
Good.
fucking thing. Well, I mean, this is just, you know, this has to be rectified long term. And why is this? Okay. I understand.
It's always third.
I understand.
Lights off, please. Thank you.
All right. Well, you get to see how we solve problems. Unfortunately, spine surgery is rarely perfect. It's again. So at least we can put that in and pull it back. The only problem is I can't do it under direct visualization.
Lights on, please. Thank you.
It just keeps deforming. Yes. I can't hear you. Yeah, the last patient can go. He's doing good? Yeah, that's fine. Yeah, that's fine. I'll see him tomorrow. Thank you. No point in keeping him waiting around. We're almost done. We'll be done in less than 10 minutes, 5 minutes. Yeah, he did great. Yeah,
Everyone's doing good. We haven't given any.
we're talking about our last patient. We did the L5S1 DLDR, L5S1 DPR right side. He wants to go home. Got tired of waiting for me to come say
0
hi.
milligram of any meds that they've had.
Yeah, he has no pain meds. It's wonderful.
We have a question.
I had a 0
Sure.
pain score on every
This comes from Benjamin on YouTube.
It's awesome, man. It's awesome. Yes, Benjamin.
They said, "Hi, how long after the video consultation, I had mine on May 8th, will I receive more information?"
Not sure what you mean by more information, Benjamin, but you had one May 8th? He said he had one?
Yes, he had one on May 8th.
I see. You should have already been contacted. Maybe we can get his name. All right, so you know what? Do me a favor, call Sam, Henry, find out the name of the patient, but do not announce it. It would be May 8th, and it would be Benjamin. See if we can get a name,
Copy that.
okay? And then, oh yeah, Sam's gone today, but see if you can reach her anyway. She left early today. I gave her some time off. Just tell her we need a Benjamin from May 8th, and I want her to call me about it. Would you text her or something like that? You got her
Yep.
phone number, right?
Yes, yes.
Just have her text me or call me later.
Copy
Tell
that.
her I'll be available in 20 minutes. I would like to know who was supposed to call Benjamin back.
Copy that.
Because, yeah, if we already did a telemed and nobody called Benjamin back, I will be not happy.
Copy that. Texting her right now. And also,
Thanks.
we have another question.
Yeah,
This,
of course.
this comes from Trust on YouTube.
Hello, Trust.
And they said, "Hello, truly amazing surgery. If insurance companies, Medicare, Medicaid declines, what can we laymen do to get these surgeries approved? It is clearly safer and cost effective and everything positive."
Yeah, Trust. What you need to do is, what? We're okay.
What do you mean? Oh, we're good.
Yeah, no. I'm just, I'm putting this in, and it's engaging, pushing the tines out, and it's allowing me to pull it back, but I can't do it under, forced endoscopic guidance. So Trust, what you need to do is talk to your politicians. Tell them you want this surgery available through governmental insurance, Medicare, Medicaid, VA. That's what you have to do. Talk to your politicians. They're called lawmakers for a reason. They make laws. And when your lawmakers are not making the right laws for you, you need to talk to them and let them know what they need to do. Okay? That's what I would recommend. That's what it's going to take. Lawmakers making laws to protect you, the patients, from having to not have coverage for necessary medical care. Right?
How much time do we have left?
Oh, less than 5 minutes. Why? You got to go?
Oh, no.
I'm just joking. You know that. I'm just, huh?
Just curious about
Less than 5 minutes. We're almost done. It's just taking a little longer because I have to keep putting the dilator back in and pulling back a little bit. Great question, Trust. We need advocates for people in government, getting our politicians, lawmakers to make laws that don't allow insurance companies to not pay for good, high-quality medical care. It's really what it comes down to. We've discovered the cure to back and neck pain. Now we just need the people who are supposed to pay for it to pay for it. One more minute, I think we're going to be done. I want to send this lady home to Pennsylvania. Pain-free is my goal. Tomorrow.
Hey, Jordan, when we're done, let's shoot a good lung field x-ray if you can.
Just get it ready. I'm almost out of the disc, so
Because I can't access the lung field with my stethoscope.
let's get this fluoro ready. I'm almost done. Literally, I think we're just about there. This is, yeah, you can see this is the outer annulus that has blood supply that we always talk about. Well, just about done. You can see inside where the herniation was. It's now gone. And I'm just finishing last part. Beautiful, look at that. I watched a movie the other night called Suzu? You know, the one with the Norwegian guy? Sisu, I think it is, right? And you know, what's interesting and I love about it is he found some gold out in, I think it was Finland. He found some gold out there digging. And when you look and see the gold in the movie, it's truly how it is. It's a vein. They call it a vein. It's called a vein of gold. And it literally is this vein. And it reminds me of the tears in the disc that we fix. 1 minute. These tears are like veins of blue, you know, the nucleus pulposus, but except gold vein you want, a blue vein you don't want. You want to get rid of it, to be honest. I want to get rid of that blue vein. 30 seconds and I should be done. That's the last of the herniation. No, we're done. We're done. We're outside the disc right there. See her jumping a little? We're done.
Lights on, please. Thank you.
Scope off. Put a little bit of antiseptic. Never had an infection in 16 years of doing Deuk laser disc repair. Not a single one. We've always used some. Why is this bag not getting sucked, guys? Come on. It's like so full here. You guys should be checking these things to make sure they're working. Let me come take it out. Get the scope.
We're all done.
All right, so we have 3 4mm incisions. That's it. We had to make one for each disc. Unfortunately, you couldn't do them all with one incision. And I'll show you guys just so you can see. There's the top one. You guys see that? Literally right there. 4mm. You say that, Henry?
Yes, we do.
Beautiful. All right, go ahead and do your stuff. I'll hold. We're all done. So if you have questions, type them up. Ask. I'll be happy to answer them. And we're just going to go ahead and end the broadcast if there's no questions.
Oh, well, you're going to take a picture, right? Yeah. All right.
Come Come on in, Jordan.
Because the SAT's,
What?
the SAT's a little low. I just want to look at the lung fields. I can't get in there with a stethoscope, obviously, so let's look at the lung fields. Take a
Well, let's get this closed up. Any questions?
No current questions.
All right, let's go ahead and end the broadcast. We're done. Thanks for being with us. Let's go. We need to do it now.